I'm Dr. Jamie Oliva, and I am a nurse practitioner by training, and have cared for stem cell transplant patients probably for over 20 years. And there is a common complication of stem cell transplant, which is called graft-versus-host disease. And all allogeneic stem cell transplant patients are at risk for developing that chronic disease, and it is because of the transplant that they develop that chronic disease. So the risk that they will develop it ranges depending on who their donor is. So the more related and histocompatible you are to your donor, the less risk that you have of developing graft-versus-host disease. But we see even some well-matched and related stem cell transplant recipients develop significant graft-versus-host disease, and that limits quality of life and can limit overall survival. And people can actually succumb to graft-versus-host disease complications, even if the malignancy they were transplanted for there is no evidence of it. So it's a big concern. So we educate our patients very well and tell them to call when they have any concerning symptom, and that could be of graft-versus-host disease or other problems, like infection is a big complication. So we educate them to call, and they're usually coming to clinic quite regularly immediately after the transplant. Then at about the 3-month point, we can start spacing their visits. They've recovered a little bit more from the immediate peri-transplant circumstances, and so they're going home at a time that is the median onset for chronic graft-versus-host disease. So we're not looking at them by virtue of the clinic visit. And so they're going home with instructions to call for problems or symptoms. When they come, so they regularly schedule clinic visits, and it's been my clinical observation that sometimes patients wait until that routine visit to report symptoms, or they perhaps might minimize the symptom because it's not really significant yet, or they've had a symptom like that before that was self-limited and they could treat it by themselves. And then when they do come to clinic, we have to rely on retrospective symptom recall. So when did you first develop this symptom? And how did it progress over time? And so patients, we're not writing down specifically, some do, we're not writing down specifically when we first noticed that symptom. So it's challenging to know exactly when the symptom exactly started and how it's progressed over time. So I thought, well, what is a way that we can help patients by giving them some type of tool to monitor it and track their symptoms, and then that will perhaps cause them to symptom report a little bit more readily, because really they need a clinical evaluation in order to be diagnosed with GVH or not. So I partnered with a company named Treatment Technologies and Insight, and they had an existing app that was modifiable, and it's based on a validated NCI tool. So we configured 10 common GVH symptoms using that existing scale and modifying it for a couple of symptoms that really weren't reflected in that tool. And those are presented to the patient every day so that they can go in, and it's just, they tap on a Likert scale if they have a symptom or not and how bad it is, like a 0 to 5 scale. So they don't have it. 3 would be moderately, then 4 and 5 are significantly impacting their life, their wellness, their health. So that is how the app really in this particular form came to be. Mobile health apps are readily available. If you go to the Google Play Store or the Apple Play Store, there are many, many mobile health apps for people to choose from. And so I was kind of, which one do we choose? So I went to the literature and I looked at the literature for mobile health apps for symptom tracking. And there were some systematic reviews. However, the results of all the systematic reviews were kind of inconclusive. No one really knew, could say that one health app was efficacious over another because of the varied types of apps and the varying methodologies of all those studies. So the first step in our journey is really to test the feasibility and usability of this app. Will the allo-stem cell transplant patients use the app, and did they find the app easily usable? So that is the design of the study that the ONS abstract is based on, the feasibility and usability of this particular app. And we did an interim analysis. So all allogeneic stem cell transplant patients are eligible to participate in the trial. It does not matter if they've had graft versus host disease or not. It's that risk that kind of is the bigger issue and really makes them eligible to participate. So we did convenience sampling and we're in clinic, and we enrolled volunteer subjects to participate. We did their informed consent process. We onboarded them to the app. So when they left the clinic, they had a app that was up and running, and they needed to symptom track for 30 days. And our interim results were that most patients use the app at least once a week, which was a defined study feasibility threshold. And we had an instrument that we measured usability. So it was a score. And usability so far for the 17 patients that we did interim analysis for, the usability score was actually very high. So it's promising that there's high feasibility and high usability. And many of the patients continue to use the app, which they were welcome to do. The study piece dropped out of it. They were welcome to use the app after their participation was over, and a high proportion of them did continue to use the app. So that speaks, in my opinion, to feasibility, usability as well. So as a first step, and when we complete this study, feasibility and usability, I anticipate those thresholds will be met, and then we can have good evidence about feasibility, usability to move to an intervention study. So that is the goal of this particular study, and interim analysis in the abstract seems very promising. Future directions for this work. So graft versus host disease is an orphan disease. It is rare. Rare diseases are very difficult to study because the number of people who have them are quite low. So a challenge in chronic graft versus host disease particularly is, will I have enough of a population at my center to get an adequate sample to do any type of cohort study where there's going to be, inferential statistics about whether or not this app, is workable in terms of symptom monitoring, reporting, and if it has any impact on the incidence of graft versus host disease, the timing of it, the severity of it at diagnosis, progression, and relapse. So a multi-center study would likely be beneficial for this particular population of patients. So I'd like to expand it a little bit into a multi-center study, an intervention study, so that we have an adequate sample. I think one interesting feature, and this was not a part of our inclusion or exclusion criteria, but as I said, patients did not necessarily have to have had graft versus host disease or not to be included in the study, but many of them did have the experience of having graft versus host disease. So, it was convenient sampling, so we weren't in there in the clinic recruiting every day. However, many of the patients who consented to be subjects in the study had had experience of graft-versus-host disease. So I have to say, did that influence their, decision to participate? Either way, either they're worried about, so if their GVH was controlled, what is it going to be like for me in the future? Or if they had current graft-versus-host disease, this is a way for me to objectively record what's going on with me. So that was a very interesting finding. I'm also, we service, I think 20 counties our center does. So people can live a bit of distance from the transplant center. And that tether, by having an objective way for them to symptom track, is an attractive feature to me as a provider, as a clinician, because I wonder if that, and that's a question that I don't know the answer to yet, but does having that app inspire them to symptom report a little bit more frequently than they would have in not having the app? Not the question we asked with the current study, but definitely a question for the future.